Welcome back to Philippines Uncut. I'm Buddy Cunanan. Tonight's topic is alternative remedies for heart problems. And still joining us is Dr. Angelita, Santa Teresa, but we're now joined by Ronnie Bernardo, who's also from the Integrated Laser and Complementary Medicine Clinic. And our subject for today, Mel Dizon, who is a tourism practitioner who's bravely volunteered to be our subject in the on-air live demonstration of this technology. So, Doctora, let's talk first about this machine. So, this is, as we see in front, there are all these numbers here. What are these supposed to be?
This one
Maybe
is
Ronnie's,
the power output.
All right.
This is the dosage of the laser.
All right.
And this is the timer. We usually set it to 30 minutes.
Okay.
But right now, we're just doing it for 10 minutes.
Okay.
And this is the wavelength.
Okay.
And the laser power.
Yeah.
And this is the filter.
Yes.
So just in case it over release the laser, this one is still controlling the release of the power.
Okay.
So right now we are doing a demo of the treatment.
Okay.
So are you?
And how long will she be treated?
Right now, 10 minutes.
10 minutes. Okay. So
3.5 power output.
okay. Now, what is this thing you're holding? This
This is just
strap.
a tourniquet to make the vein prominent.
Okay.
Yeah, we'll do the puncture in the antecubital fossa, which is the brachial vein.
Okay, let's see it. Let's see it.
Because this area has a better veins, bigger, and it's less painful in this area.
Okay. Now, how many times have you done this, Ronnie?
Many times.
All right. So, Mel,
So
are
I've been
you
doing this
scared?
for-
No, you're not scared. All right. All right.
Yeah.
In the clinic setting,
Yeah.
the patient may assume either a reclining position or the sitting
sitting
position.
Can she lean back a
Well,
little bit? It's okay.
In
no?
our clinic, we have the recliners, so
Yeah.
Okay.
they can.
Okay.
But here, we don't have it, so she'll just take the sitting position.
So, Doctora, what we're seeing now is essentially what goes on in your clinic. This is exactly what happens. The same
In the
machine.
integrated
Yeah.
Laser and Complementary Medicine
Yeah.
Clinic.
Now, as far as I know, Mel is not suffering from any kind of illness or whatever.
Aren't you?
No. But let's say for a healthy person, what are the benefits? Please continue.
You know, as I've mentioned to you, like the benefits is from A to Z, right? In her case, it can be for maintenance, and for the letter Y, which is for youth or anti-aging.
Oh, really?
Yes.
Okay.
It gives you that additional energy, right?
Yeah. Now, Doctora, okay, when you say A to Z, okay, what you mean by this is that this can treat a host, a very wide range of
Yes.
illnesses and conditions.
Yes, and
Why
when
is
I
that? How
mean
is that?
A to Z, it really
Literally
stands
A
for
to
the
Z.
different disorders under the different letters
Okay, let's
of
have
the
Z.
English alphabet.
Okay, Z. Give us a disorder that starts with Z.
Zoonotic infections.
What is that? In layperson's terms.
Okay,
What is that?
these are infections that can be relayed or conveyed or transferred
All right.
from animals to human beings.
okay,
Okay, in the States or other areas in Europe,
Yeah.
they have a lot of cases of Lyme's disease. But
From the
like
deer,
here,
from the
for
pigs,
instance,
right.
yes, we have leptospirosis
Yeah.
from the rats, mice. So,
Yes, yes. So this can be used to treat that as well.
yes.
Okay. Now, before I go
Because
into...
it is actually effective against different microorganisms.
Okay.
Because it builds up the immune system.
Yeah. Now, pero Doctora, how is it possible that this thing is able to
Yeah.
treat all these, as you said, from A to Z, all these
Yes,
illnesses, all
because
these
as I've told you, it has different effects, starting with the cellular membrane and the protein polymers and the different structures. It affects actually, in general, three systems: the
Yeah.
circulatory, the digestive, and the nervous system, digestive, metabolic.
so
And there are a lot of disorders under these three systems.
For
Yeah.
sure. And when you mention those three, that really is the human body right there.
And when I say nervous system, it includes both the central and the autonomic, the sympathetic and the parasympathetic.
Yeah.
That's why they also use that for schizophrenic
Schizophrenia.
patients. Yeah.
Now, more on that, but let's have Ronnie annotate first what he's doing. Okay, Ronnie, explain.
Right now, we're inserting this
Okay.
is the fiber optic needle.
Okay, so I can see the fiber optic wire.
It delivers the laser to
Now,
the
can you hold the needle up so
bloodstream.
our audience can see
yeah,
it?
it's The needle is just like a ordinary needle, but that makes it special is the fiber optic inside the needle.
Yes. So that delivers the laser.
Yeah,
or the
it
light.
delivers the laser.
And as I mentioned earlier, I asked them, you're not going to put the whole needle into Mel's arm.
No, it's just
This is
a
a big needle.
point of entry.
All right.
So
Let's do it. Come on.
Yeah, come on.
You know, I'm brave because I'm not the subject, so I can. Okay, let's see
We'll
this.
insert the vein, the needle.
Okay, relax.
Okay. Now it's
That's
done.
it.
Yeah, that's it.
Mel, did
So-
you feel anything? No pain?
No,
Nothing?
okay.
Nothing?
Your fear was worse, yeah? The fear was worse.
So now the needle is in and I can see the fiber optic
Yeah.
wire dangling. Very interesting, very interesting. Okay. So it's
Now,
actually, compared to
This
having
fiber
your-
optic will be, we'll put it here.
Now, how should Mel's arm be? Should it be resting?
It should be resting,
So
yeah.
maybe put it down on the armrest. There you
Yeah,
go.
okay.
And then you fix that the device
Yeah.
is also strapped to her wrist
Okay.
to keep it in place.
Yes.
Okay. Now, Doctora, let's say in terms of health and wellness, this kind of thing can, let's say for a healthy person, can contribute to giving that person more energy, more vitality, and so...
Yes, because in the first place, when you change the membrane structure and activity, like you allow it to be,
Wait, this is interesting. I can see now,
This is-
visually,
Yeah.
we can see, what is that red light?
This is a laser.
that's
Okay.
a laser.
Can we zoom here, please?
If you turn off the light, you can see it much lighter. I mean,
Yes,
brighter.
yes. No, but I can,
If
I can
you-
actually see the light also here.
yeah, we just try
There
to
you go.
cover it. Yeah.
There you
See?
go. Well, can we zoom on that there? So I can actually see a
Yeah.
light inside
Yeah.
Mel's arm.
Yes.
Amazing, amazing.
Yes.
Wow.
So the blood carries the light and circulates it.
Yeah.
So,
Now, for some people, they might say that how come we are looking at the laser? Because it is written that there are some side effects for laser things. But
Are
this
there any
one
side effects to
doesn't
this?
really have. But just so that the patient won't feel like, oh my gosh, they let me or they allowed me to look at it and, for several sessions, and now I'm reading that it's not really good to look at it.
Yes.
So clinic setting, we put some kind of a cloth
Yeah.
to cover it.
Okay. All right. And I have a friend whose wife has heart disease, and she underwent chelation. And here, as we mentioned earlier, in chelation, they use some sort of substance, like like a liquid that they put in the body. In this case, nothing at all. No? It's really just light.
With the, may I mention?
Yes.
Like the calcium chelation, we have what we call drag and drop phenomenon.
What's that?
So they may be able to get some toxins from, say, your heart, but then drop it somewhere in your liver.
Yes.
So
Tell us a bit about, okay, since we're on the topic of heart disease, what about people suffering from, let's say, people who've had a stroke, and the most common symptom of a stroke is partial paralysis of the body, usually one side of the body, you lose
Yeah.
feeling or
even let's say the four extremities,
Yeah.
that's under Q,
Yes.
the quadriparesis.
Yeah.
No?
How can this help people,
Yeah.
stroke victims, for instance?
Yes, when you have this weakness, oftentimes there's a certain area in your brain that is receiving less circulation or blood. So what the modality does is to improve that circulation in that part, or
Yeah.
what we call the microcirculation. And so for the patient, as long as the patient subjected to the number of sessions that was advised to him, there's a very big possibility that he'll be able to have those extremities normal or back again.
Interesting. And have you guys had success with stroke patients?
And in Cebu, I think.
Yes. Okay, let's go here. As you see, there's a power indicator. How
Output.
much power do you guys need to? I mean, like it would depend on what exactly?
Depend on the condition.
Okay.
And usually we do 3.5, 2.5 to 3.5.
Yeah.
In Mel's case, I use 3.5 because we're only doing it for 10 minutes.
Yes. Yes.
No, but lower dosage you can do like 30 minutes.
Now, she'll do this just for 10 minutes. This is actually just a sample of what goes on in the clinic. But
Yeah.
what can she expect after this? I mean, would you be able to feel a change in yourself, let's say, or what feeling would Mel have after this treatment? Would there be something already perceptible?
In my case, I feel more energized, relaxed. I can think clearly. Even with, I'm
It's
doing
case
a
to
lot.
case
Yeah,
basis.
it's case to case. I noticed that you can see the dramatic results if you have already problems. You can see the changes.
Yeah.
But if you are really normal, it's more for preventive. You
Preventive
don't see
treatment.
it right away. But a lot of my patients, they said they feel more energized. They want to keep coming back because they're old. They can already take the stairs.
Okay. Doctora, we have about 30 seconds to close. Would you like to say something to the audience before we go?
Yeah, I would like to invite and encourage the other medical practitioners if they could at least try first this modality before rejecting it. Okay, and I'm so glad that, well, amidst the pork barrel scams, price hikes, and other problems that the Philippines is facing, finally we have a break. We have some good news in the form of this modality, courtesy of our generous kababayan, Mr. Rommel Santos. I'm so grateful to him and for having me as well. He's actually the one who endorsed me to Mr. Rommel Santos. And thank you for having us here.
Well, pleasure. Thank you for taking time out from your busy schedule to join us. Thank you very much, Doctora, and
It's
of
my
course,
pleasure.
Ronnie. And thank you, Mel, for being our subject for today. And God bless you guys and more power.
Yeah.
Thank you.
Thank you, thank you.
So guys, I hope you learned a lot about intravenous laser therapy and alternative remedies for heart problems here in Philippines Uncut. Join us again next week in the show where we talk about what matters to you because you guys matter the most. I'll see you next week.
It over release the laser. This one is still controlling the release of the power.
Okay.
So right now we are doing a demo of the treatment.
Okay.
So are you?
And how long will she be treated?
Right now, 10 minutes.
10 minutes. Okay. So
3.5 power output.
okay. Now, what is this? Is as we see in front there, all these numbers here. What are these
Yes.
supposed to be?
This one
maybe
is
Ronnie's,
the power
yeah.
output.
All
This is
right.
the dosage of the laser.
All right.
And this one's the timer. We usually set it to 30 minutes.
Okay.
But right now we're just doing it for 10 minutes.
Okay.
And this is the wavelength
Okay.
and the laser power.
Yeah.
And this is the filter.
Yes.
So
yes.
just in case
Welcome back to Philippines Uncut. I'm Buddy Cunanan. Tonight's topic is alternative remedies for heart problems. And still joining, this thing you're holding, this
this
green
is just
strap.
a tourniquet to make the vein prominent.
Okay.
Yeah, we'll do the puncture in the antecubital fossa, which is the brachial vein.
Okay, let's see it. Let's see it.
Because this area has a better veins, bigger, and it's less painful in this area.
Okay. Now, how many times have you done this, Ronnie?
Many times.
Joining us is Doctora Angelita, Teresa, but we're now joined by Ronnie Bernardo, who's also from the Integrated Laser and Complementary Medicine Clinic. And our subject for today, Mel Dizon, who is a tourism practitioner who has bravely volunteered to be our subject in the on-air live demonstration of this technology. So, Doctora, let's talk first about this machine. So,